Anneliese Dressel of the Health Hub Times Square in Ballincollig joining me this afternoon. Good afternoon, Anneliese.
Good afternoon, Patricia.
And questions already coming in. Bernie's taking the calls at 0818 103 103. I saw a report before I came online this morning. Now, it is from the British Menopause Society, but I'm assuming the results would be the same here. Quite a big survey of menopausal and perimenopausal women, 2,000. And of them, 75% said they had problems sleeping. It was either in difficulty in getting to sleep or both getting to sleep and then staying asleep. And they found that the most common time to wake in the night for menopausal and perimenopausal women was between 3 a.m. and 4 a.m. and that was followed closely by 2 a.m. and 3 a.m. And the doctors who took part in this study were just talking about the knock-on effect of disturbed sleep. It can affect your mood, impair your judgment, your concentration, and actually said that it can lead to anxiety. But I was surprised at how high the figure was. 75% having sleep problems. Is that something you commonly hear about, Anneliese?
Yeah, definitely. It would be one of the most common problems. And it may or may not be related to the night sweats. So for a lot of people, it is related to the night sweats. They're waking up and they're covered in sweat. Some women even have to get up and change out of their pyjamas and put on a fresh pair. So that can be the issue for some people. Other people, it's waking up to go to the loo, that the bladder isn't able to hold as much. And then some people, it just is pure lack of sleep. So very common problem. And I think that it should improve with HRT or with natural HRT products, but you can take natural sleep remedies as well. Actually, the interesting thing there about the times that you mentioned, Patricia, is that in Chinese medicine, the liver, that is when the liver is very active at that period, kind of between 2 a.m. to 4 a.m. at night time. And the liver is really, really, really important for detoxifying and especially for hormones. And I think that's where a lot of hormone imbalance comes from. I think our livers are not doing a good job at getting rid of hormones when they need to be getting rid of. Also, I think the gut plays a big role as well because there's bacteria in your gut that can actually break apart the bonds that get rid, that hold the estrogen and progesterone that's being detoxified. It can break those bonds and send those back into circulation. And I do think that, that's a big issue for a lot of modern people because of diet. Their gut isn't healthy, and I think liver is a bit overwhelmed as well. So that's very interesting. So natural sleep remedies then would be worth giving a go to. So some people benefit from magnesium. Glycine is another one. So if you can actually get the magnesium bisglycinate, you get the benefit of both the glycine and the magnesium in that. And then there's much better ones, stronger ones that are very good for stopping the busy brain. And these would be things like that have got valerian in there, chamomile, passion flower, passiflora, what else is very good? Lemon balm is great, L-theanine. And one of the ones that works best here for us is the NHP Advanced Sleep Support, and it's got about 8 or 10 different herbs in there that are very good for sleep. But go into your local health shop because they will be able to help with something. And then if it's the sweats that are waking you up, sage is definitely the best for that.
Yeah, and then I know we've spoken with sleep experts, not necessarily now to do with menopause, but when they talk about good sleep hygiene, don't have the phones in the bed with you and, make the bedroom as comfortable, don't have it overheated.
Yeah, have no LED lights on in the room.
Yeah.
Stop drinking caffeine at about 3 o'clock in the afternoon. Try not to drink anything else after about 9 o'clock at night, so that you're not waking up to go to the loo. Try and empty your bladder fully before you go to bed. Those are all great things, but I think what's happening for a lot of menopause people is they wake up and their brain is immediately kicking in.
That's it.
So it's about trying to calm that brain down. And I think sometimes if you are awake, just accept it, listen to a nice podcast, and hopefully you'll drift back off.
Yeah, that 100%. That's thankfully in touch wood, I'm a good sleeper. But if I wake, podcast gets me. It has to be speech, but it gets me right back to sleep straight away. Okay, question for Anneliese, please. What would you recommend supplements for somebody suffering from rheumatoid arthritis?
Okay, so rheumatoid arthritis is different from the wear and tear arthritis in that it's an autoimmune disease where the body's immune system is actually attacking the joints itself. So rheumatoid arthritis will be different in that it kind of affects both sides of the body at the same time, and it mostly would affect wrists and knees and ankles would be very common as well. Mostly it's detected by your doctor doing a test and looking for the rheumatoid factor in your blood. And there would be normally a family history of autoimmune. So my own experience, Patricia, is that I would say 90% of the time people who come to me with autoimmune diseases have IBS. I think that food intolerance plays a big role in sort of, I suppose, overstimulating maybe the immune system, and gut health is very important. So if the gut is healthy, that is the beginning of kind of a balanced immune system approach. So if you think that that would be relevant, get the gut sorted. But typical supplements that would work for rheumatoid arthritis would be things like natural anti-inflammatories. So you're looking at curcumin, which is the extract of turmeric. Boswellia is another lovely one as well. Pine bark extract is another great natural anti-inflammatory. And we have a product here called Curcudyne 40, which is made by a company called NutriAdvanced, and I would use that quite a lot for people in flare-ups, and it seems to work very, very well. It's a combination of Boswellia and curcumin. So that would be one. Omega-3 fish oils are very good as well because they can help kind of resolve inflammation, and also they're very natural anti-inflammatories. Again, this company, NutriAdvanced, have done a lot of research and are using something called OptiResol, which is a different type of structured fish oil which can help to resolve inflammation. So it's very good if you're in a flare-up. So that's called OptiResol. But for other people, a good quality fish oil would be very important. And then vitamin D is the last thing. I think anyone who's got an autoimmune disease probably should be taking a higher dose of vitamin D than normal, maybe 2,000 or 3,000 IUs. But make sure that you get your blood vitamin D levels checked when you go back for blood tests at your doctor, just to make sure you're not taking too much.
Okay, just go back to when we were talking about people having problems sleeping, particularly during menopause. A question just came in at the end saying, what is Anneliese's view on skullcap, and is that any good to help you sleep?
Yeah, definitely. It's one of the lovely herbs, and it is in that NHP Advanced Sleep Support. Skullcap is one of the herbs. The sleep stuff is very difficult, Patricia, because what will work really well for one person mightn't work for the other, and I see that all the time here in the shop. Melatonin is another lovely one I didn't mention because, unfortunately, here it's only on prescription. Yeah. But if you're going on your Holliers, you can get it over there because it's totally, it's very natural, very little to no side effects. And again, this is a kind of a sleep hormone that possibly has become disrupted. So that can work well for some people. But I think you'll need to try a few and try and go for one that's a blend of different things so that you're getting the benefit of a lot of different herbs.
Okay, hi, this is from Molly. My son has sinus for the last 2 months. He's been on 2 antibiotics, he's been on steroids, he's been on antihistamines, he's been on Sinew tabs. Nothing is working. His nose is constantly streaming green mucus. Any help and advice, please? Oh, that sounds miserable.
Miserable, and a lot of people suffer from sinus all year round, Patricia, as well, and it can be very debilitating. The fact that it's a green mucus doesn't sound good to me. That sounds like there's an infection there for sure. So it's a difficult one, sinus, because sometimes it is more than just an infection that's going on. Generally, the body will produce mucus as a kind of an immune response, which is why if you're allergic to something, you'll fill up with mucus, and why when you've got a cold virus, your body produces a load of mucus to try and trap the virus bacteria, and so that the immune system the T cells can come along and chomp it up and get rid of it. So mucus production is generally an immune response, and if it's going on all the time, it's probably something either in the atmosphere or it's something that you're eating that is contributing. So maybe the first thing I would suggest for this poor lad is something like a proper decongestant, natural. So Dr. Dealish Clare does a lovely decongestant blend. It's very bitter. It's really, really good. It works very well. Lots of my customers have said it's resolved their postnasal drip as well. So that could work very well. Or if you can get your hands on it, the Dr. Clare Mucotone is also quite nice because it's got a bit of echinacea in there. But my first choice would be her congestion blend. If you can't get your hands on any of those, you're looking for things that have got thyme, plantago, ivy, actually skullcap, which has got more than one function. It's also good for anything respiratory. If you could get something like with marshmallow and mullein, a combination of all of those herbs is very good. I would definitely support the immune system with a kind of a general vitamin A, C, E and zinc supplement just to make sure that it's not a deficiency in any of those. And then one of the things I find best for an infection in the sinus is to do a steam inhalation where you have a bowl of boiling water and throw in a couple of drops of oregano oil. It's a great one for killing off anything, and when you inhale it, it can get right up into the sinuses. But my advice is actually start with maybe 1 or 2 drops because it's really strong, and then try and build it up to more drops if you possibly can, and do that at least once a day. And see how far you get with that. And if you can't get anywhere, you're probably going to have a look and see, are there allergies or intolerances.
Okay, Liz is struggling as well. She's had 4 antibiotics and 12 days of steroids. She recently had an x-ray which showed she needs to get more air into her lungs to open them up. She has a terrible cough. She has taken Exputex. Is there anything else that you can recommend? It's been going on now for about 5 weeks.
Yeah, I think, Patricia, COVID has actually damaged quite a few people's lungs. That the lung capacity isn't as good. I definitely had noticed myself, even though I had a very easy COVID, I had no symptoms. But my lungs, I definitely lost puff. So I think it's all about protecting and nourishing your lungs. So in this case here, where there's actually a very bad cough and infection, I would without a doubt do the Dr. Clare Mucotone, because that has got immune boosting and lung protective stuff. But I'd also take a cough bottle for the cough. My go-tos tend to be either the Comvita Manuka honey elixir, or I love the Pucca elderberry syrup as well. That's got a lot of thyme in there. And I'm also a big fan of olive leaf extract, which is a great one just for anything viral that's not shifting, really. I think it always just gets you that last 20% better. So it's great if you've got the flu, it's great if you've shingles, it's great if you have a viral cold you can't shift. So I'd say do a combination of the 3 of those things, and hopefully that'll get you over the line.
Yeah, because Mary in Butterfield had COVID. Now, it was just last week, but she's still very short of breath. She's also started to get hot flushes after COVID, and that could just be, I don't know whether it's related to COVID, is it just a coincidence? She's anything you can suggest, particularly the shortness of breath. So that would be similar as well. Yeah,
similar to that. I mean, again, the shortness of breath, if there's mucus in the chest, all of that advice will apply. But if your chest is clear, I'd say possibly you might need an inhaler. The salt pipe can be very good for helping clear a chest as well. It basically is just a kind of a plastic pipe of a thing with salt crystals in there, and you breathe kind of air in through it, and it gets micro particles of the salt into the lungs. And it is a good one for kind of strengthening the lungs and for dealing with mucus and toughening up the lungs, I suppose, really is a basic way of putting it. So that might help. But I do know, Patricia, I've an awful lot of people, I know myself and a lot of customers, have actually had to take inhalers after COVID.
Yeah, it certainly is damaging the lungs. West Cork listener has hives for about the last 4 weeks, very itchy. Doctor gave her cortisone cream. She's wondering, could Anneliese recommend anything more effective for hives?
So hives typically would be a kind of a histamine response, an allergic response, so obviously reacted to something. What I'd suggest is you take, actually, I would go and get an antihistamine over the counter, or an antihistamine cream. But if you want to go the natural route, I would use quercetin, is one of the best natural anti-inflammatories. And there's a couple of different companies do quercetin in a supplement. I know Viridian do one, BioCare do an excellent one, Nature's Plus do a very good one. And that would work as a natural antihistamine. The other thing as well is that if histamine has built up in the body, there are bacteria in the gut that can actually break it down, and there's bacteria that can produce it. So taking a good probiotic with the bacteria that can help break histamine down in the gut, where there's actually quite a lot of it, can really reduce your overall histamine levels. And you don't have to spend a lot. I know that Optibac, they've done a lot of research on histamine strains. I think they're everyday. Optibac Everyday is a good one to take. That's got those strains in there. Another one is like the Lactobacillus rhamnosus can help very well as well, and Viridian do one of those. So take a probiotic, take a natural antihistamine, and then in terms of creams, the Dr. Clare anti-itch cream is brilliant. It really does take the itch out.
A lot of people worried on sleep today. Pat says, is MAG 365 any good for sleep?
So again, it is... Magnesium is very popular for sleep, Patricia. People take it for all sorts of reasons. I'm not convinced personally, myself, that it will get you to sleep. But for some people, it does seem to work well. Magnesium is very good for kind of relaxing the body. So if you're maybe not sleeping because you're a bit wound up, it could work for that. Mag 365 is one of those magnesiums, but it's magnesium citrate, and my favourite one for sleep is the magnesium bisglycinate, because glycine is fantastic for sleep as well. But the Mag 365, the one thing I would say about it is that just make sure you're putting it in with very hot water to dissolve it, and you can top it up then with cold water. And it is good to get a nice strong dose of magnesium into you. But if you find it's not working, maybe go for something with some more kind of sleep herbs in there, like the valerian and the skullcap and the theanine and the lemon balm, passiflora, like that. NHP Advanced Sleep Support has all of them, and we get great feedback on it.
Okay, listen, have a lovely weekend. We'll chat to you again next Monday.
Thanks, Patricia.
Thanks a million. That is Anneliese, Health Hub Times Square in Ballincollig.